is asked. Some folks brag about pets eating mosranna and saranna. Is that good?
No,
No,
it
they
doesn't
need a
cover
complete
anything.
nutrition. Yeah.
Yeah, it probably definitely gives them the calories, but not anything. And there are some dogs that are lactose intolerant. So if you're getting mozzarella, if they can handle it, that's fine, but never as a meal, as a treat maybe, but not as a meal. But
Yeah, not as a
saru, not good for them. They can handle the spices, I think.
yeah. It can give a severe pancreatitis to them. And I mean, ಈಗ annual blood work ಹೋದ್ರೆ you will come to know about the pancreatic health also. We'll check amylase and lipase enzymes too. I do see, I mean, ಎಲ್ಲಿ ನನ್ನ blood work ನೋಡಿ amylase lipase ಎಲ್ಲಿ elevate ಆಗಿರುತ್ತೋ ಅಲ್ಲಿ ಹೋಗಿ ಕೇಳ್ತೀನಿ, what is the diet of this dog? ಅಂತ they will let me know. He eats everything, the ice cream, you name it. They will give everything to their pet. And I was like, definitely he's gonna get admitted to emergency one day pretty soon ಅಂತ. Yeah.
So that's yeah. ತುಂಬಾ ಜನ ನಾನು ಹೇಳಿದ್ದೇನೆ ಸಾರಾನ. I mean, ಯಾರೋ question ಕೇಳಿದ್ದಕ್ಕೆ I also wanted to ask you that question, but ಕೇಳಿದ್ರು. And Dr. Leela, coming to you, you deal with exotic animals ಅಂತ ಹೇಳಿದ್ರಿ. So I mean, ಯಾವ ತರ and like what is your take on that and your specialty or ಸ್ವಲ್ಪ
Yeah,
ಹೇಳಿ.
nowadays ಸ್ವಲ್ಪ exotics ನೋಡೋದು ಕಮ್ಮಿ ಆಗಿದೆ, but I do see a lot of like rabbits. So snakes ತಗೊಂಡ್ಬರ್ತಾರೆ. I'm very much afraid of snakes. To be honest with you, I don't like the wiggly creatures. I don't know, I have a lot of phobia towards it. I know like how to treat snakes, but ಅವ್ರು ತಗೊಂಡ್ಬಂದ್ರೆ you have to hold. Sorry, I cannot hold the snake, but I will know the treatment option for them. Turtles, so birds, so guinea pigs, so lizards, so there are various like exotic species we have. And one time I came across the Arctic fox also. So one thing about the exotic pets nan helodandre, if you guys don't know how to take care of them, please don't get them. Every
Can you hear me
species
now?
is different.
Yes,
Yeah.
Oh yeah,
Madan.
finally
Okay.
Madan
Yes.
is back.
My kids,
Yeah,
those
exotic pets
those from
ತಗೊಂಡ್
next.
ಬರ್ತೀರಾ ಅಂದ್ರೆ please be careful with their behavior, their habitat. You should know about their nutrition. ಅವುಗಳದೇ ಆದ socialization different ಇರುತ್ತೆ. So you need to be very mindful of exotic pets. You don't know anything about them, please don't get them.
So you are advocacy of not, harboring or uh, exotic animals as pets.
No, no. Nandu as a individual person, ನನ್ನ opinion ಏನು ಅಂದ್ರೆ let them live wild ಅಂತ. I don't
That's the best
encourage
one.
exotic pets, but it's up to the person who is getting. But if you are getting it, please make sure that you take a good care of them and you are knowledgeable about those pets, and then only you can bring them in. ಯಾರೋ ಏನೋ ಕೊಟ್ರು, ಇಲ್ಲ ಅವ್ರ ಮನೇಲಿ ಏನೋ ಬರ್ಡ್ ಇದೆ ನಾನು ತಗೋ ಬರ್ತೀನಿ. ನೋ, ಬರ್ಡ್ಸ್ ಹ್ಯಾವ್ ಅ ಡಿಫ್ರೆಂಟ್ kind of socialization ಇಲ್ಲ nutrition. They're so much different. You cannot just treat them as your regular dog and cat anta. No, I know
You
dog
cannot
and
live.
cats are pets since ages, right? But ಈಗೆಲ್ಲ ಫ್ಯಾನ್ಸಿ ಪೆಟ್ಸ್ ಎಲ್ಲ ತಗೊಂಡ್ ಬರ್ತಾರೆ. They don't even know like what they need ಅಂತ. I have operated on a turtle where it ate all the small pebbles, stones, full body ಎಲ್ಲ GI system was loaded with the pebbles. So you need to know like what kind of substrate to get. I mean, a lot of them need a proper temperature, lighting, or socialization, or nutrition will be different. So you need to be aware of all those things before getting the exotic pets. Yeah.
Dr. Madan, you're back.
Yes.
Thank you. So ನನ್ನ question repeat ಮಾಡ್ಲಾ ಅಥವಾ I'll just repeat the question for my viewers once again. So ನೀವು ಮೈಸೂರಲ್ಲಿ you're a practicing veterinarian and you're on call for the Mysore Zoo as well. So Indiaಲಿ how has pet care and welfare transitioned from the in the years ಅಂತ ಅದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಮಾತಾಡ್ತೀರಾ? And ನಿಮ್ಮ expertise ಬಗ್ಗೆನೂ ನೀವು ಸ್ವಲ್ಪ ಹೇಳಿ.
I practice both small animal and wild animals, ma'am. See, this is my 7th year. I'm practicing in Mysore Zoo. I'm basically a small animal practitioner, so that made me like few of the doctors from Mysore Zoo. They called me for some surgeries, so I developed interest over wild animals again. So it's been 7 years now there. So ಈಗ ನೀವು ಪೆಟ್ ಪ್ರಾಕ್ಟೀಸ್ ಬಗ್ಗೆ ಕೇಳೋದಾದ್ರೆ I can say past one decade ಅಂದ್ರೆ last 10 years ಇಂದ there is drastic improvement. in the technical aspects. ಸೊ ಈಗ ನಾನು ಮೈಸೂರಲ್ಲಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತೀನಿ. ದಿಸ್ ನಾವು ನಮ್ಮ ಹಾಸ್ಪಿಟಲ್ ವಿ ಹ್ಯಾವ್ ಫಾರ್ ಅವರ್ ಅದರ್ ಡಾಕ್ಟರ್ಸ್ ಹೇಳೋದಾದ್ರೆ ವಿ ಹ್ಯಾವ್ ಆಲ್ ದ ಟೆಕ್ನಿಕಲ್ ಫೆಸಿಲಿಟೀಸ್ ಲೈಕ್ ಸಿಂಪಲ್ ಫ್ರಮ್ ಬ್ಲಡ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಹಿಡಿದು ವಿ ಹ್ಯಾವ್ DR, ಫ್ಲೂರೋಸ್ಕೋಪಿ ಅಂಡ್ ಎಂಡೋಸ್ಕೋಪಿಸ್ ಎಲ್ಲ. ಈ ಮೈಸೂರಿಯನ್ಸ್ ಒಂದು ನಾನು ಇಫ್ ಐ ಟೇಕ್ ಒನ್ ಮೈಸೂರಿಯನ್ಸ್ ಅಂತ ನಾನು ತಗೊಂಡ್ರೆ ಇಟ್ಸ್ ವೆರಿ ನ್ಯೂ ಫಾರ್ ದೆಮ್. ಈಗ ಒಂದು ಕ್ರಾನಿಕ್ ವಾಮಿಷನ್ ಇದೆ, ಒಂದು ಎಂಡೋಸ್ಕೋಪಿ ಮಾಡ್ಕೋತೀವಿ ಅಂತಂದ್ರೆ ದೇ ಫೀಲ್ ಇಟ್ ಇಸ್ ಪಾಸಿಬಲ್ ಇನ್ ವೆಟ್ಸ್, ಪಾಸಿಬಲ್ ಇನ್ ಡಾಗ್ಸ್ ಅಂತ ಅವ್ರಿಗೊಂದು ಪ್ರಶ್ನೆ ಇದೆ. ಇಟ್ ಇಸ್ ಸರ್ಪ್ರೈಸಿಂಗ್ ಫಾರ್ ದಮ್, ಇಸ್ ಸರ್ಪ್ರೈಸಿಂಗ್ ಫ್ಯಾಕ್ಟರ್ ಅವ್ರಿಗೆ. ಐ ಡೋಂಟ್ ಥಿಂಕ್ ದಿಸ್ ಇಸ್ ಸೇಮ್ ವಿತ್ ಅಟ್ ಯುವರ್ ಪ್ಲೇಸ್ ಮ್ಯಾಮ್ ಅಲ್ಲ. ಸೊ ಇದೇನಾಗ್ತಾ ಇದೆ, ನಾವು ಪೀಪಲ್ ಆರ್ ಗೆಟಿಂಗ್ ಟು ನೋ, ದೇ ಆರ್ ಗೆಟಿಂಗ್ ಟು ನೋ ಲೈಕ್ ವಾಟ್ ಡೆವಲಪ್ಮೆಂಟ್ಸ್ ಆರ್ ಹ್ಯಾಪನಿಂಗ್ ಇನ್ ವೆಟರ್ನರಿ ಆಸ್ಪೆಕ್ಟ್ ಅಂಡ್ ವಾಟ್ ಕೇರ್ ವಿ ಆರ್ ಟೇಕಿಂಗ್ ಗಿವಿಂಗ್ ಫಾರ್ ದೆಮ್. ಸೊ ದರ್ ಇಸ್ ಲಾಟ್ ಆಫ್ ಡಿಫ್ರೆನ್ಸ್ ಬಿಡಿ. ನನ್ನ ಒಂದು ಇದ್ರಲ್ಲಿ ತಗೊಂಡು ನಾನು ಓದ್ಬೇಕಾದ್ರು ಹಂಗೇನೆ 10 years ago ಏನದಿತ್ತು ಈಗ ಹೆಂಗಿದೆ, ದರ್ ಇಸ್ ಲಾಟ್ ಆಫ್ ಚೇಂಜಸ್. ಇನ್ ನೆಕ್ಸ್ಟ್ ಡಿಕೇಡ್ ಅಲ್ಲೂ ಕೂಡ ಇನ್ನೂ ಚೇಂಜಸ್ ಆಗುತ್ತೆ. ಸೊ ಇದನ್ನ ಹೇಳ್ತೇನೆ. ಸೊ when
Yes,
it comes
very.
to Mysore Zoo, so same thing is going on. ತುಂಬಾ 130 ವರ್ಷ ಈಗ ಝೂಗೆ. ಆಗ ವೆಟನರಿ ಡಾಕ್ಟರ್ಸ್ ಇರ್ಲಿಲ್ಲ 30-40 years ಹಿಂದ್ಗಡೆ. ಒಬ್ರು ಡಾಕ್ಟರ್ ಬರ್ತಾರೆ, ಈಗ್ಲೂ ದೇ ಕನ್ಸಲ್ಟ್ ಮೈಸೂರು ಝೂ. ಅವರ ಫಾದರ್ ಈಸನ್ ಅರಮನೆಯಲ್ಲಿ ಅವ್ರ ಡಾಕ್ಟರ್, ಅವರು ಫಾರ್ ಮೈಸೂರು ಪ್ಯಾಲೇಸ್ ಅಲ್ಲಿ ಅವ್ರ ಡಾಕ್ಟರ್ ಫಾದರ್. ಅವ್ರು ಈಗ ಅವರ ಮಗ ಬರ್ತಾ ಇದ್ರು, ಅವ್ರು ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ ಬರ್ತಾ ಇದ್ರು. ಈಗ ಅವರೇ ನಮ್ಮ ಪ್ರೈಮೇಟ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಆಗಿ ಬರ್ತಾರೆ. ಬಿಕಾಸ್ ಈ ನೋಸ್ ಇನ್ ಅಂಡ್ ಔಟ್ಸ್ ಆಫ್ ಪ್ರೈಮೇಟ್ಸ್, ಬಿಹೇವಿಯರಲ್ ಆಸ್ಪೆಕ್ಟ್ಸ್. ಪ್ರೈಮೇಟ್ಸ್ ಅಂದ್ರೆ ಏಪ್ಸ್, ಗ್ರೇಟ್ ಏಪ್ಸ್ ಮ್ಯಾಮ್, ಗೊರಿಲಾಸ್, ಒರಂಗುಟಾನ್ಸ್, ಚಿಂಪಾಂಜೀಸ್, ಇದಕ್ಕೆ ಮಾತ್ರ ಕನ್ಸಲ್ಟ್ ಮಾಡಕ್ ಬರ್ತಾರೆ ಅವರು. ಅವ್ರ ಹತ್ರ ತುಂಬಾ ಇಂಟ್ರಾಕ್ಟ್ ಮಾಡಕ್ ಟ್ರೈ ಮಾಡ್ತೀನಿ, ಅವ್ರ ಹತ್ರ ಯಾವ ತರ ಇತ್ತು ಅಂತ ಹೇಳಿ. ಮುಂಚೆ ಈ ವೆಟನರಿ ಡಾಕ್ಟರ್ಸ್ ಅನ್ನೋದೇ ಇರ್ತಿರ್ಲಿಲ್ಲ 60s 70s. ಮೈಸೂರು ಝೂ ವಾಸ್ ಮ್ಯಾನೇಜ್ ಬೈ ಹ್ಯೂಮನ್ ಡಾಕ್ಟರ್ಸ್. ಅವರು ಹೇಳ್ತಾರೆ, ಯಾವಾಗ ಬಂದವರು ಕೂಡ ಕಾನ್ಫರೆನ್ಸ್ ಅಲ್ಲಿ ಹೇಳ್ತಾರೆ, ನೌ ವೆಟ್ಸ್ ಹ್ಯಾವ್ ಚೇಂಜ್ಡ್ ಇನ್ ಎಕ್ಸ್ಟೆಂಟ್ ದಟ್ ದೇ ಹ್ಯಾವ್ ಬಾಟ್ ಫ್ರಮ್ ದೇ ಕೇಮ್ ಫ್ರಮ್ ಸ್ಪ್ಯಾರೋ ಟು ಅನ್ ಎಲಿಫೆಂಟ್ ಅಂತ. ಅಷ್ಟು ಚೇಂಜ್ ಮಾಡಿದ್ದಾರೆ ಈ ರೀಸೆಂಟ್ ಇಯರ್ಸ್ ಅಲ್ಲಿ. ಸೊ ಏನೇನ್ ನಮ್ಮ ಒಂದು ಇದರಲ್ಲಿ ಆಗ್ತಾ ಇದೆ, ಸೊ ಅದೇ ಮಟ್ಟಲ್ಲಿ ನಮ್ಮ ಮೈಸೂರು ಝೂ ಅಲ್ಲೂ ಎಲ್ಲಾನು ಮಾಡ್ತಾ ಇದಾರೆ ಅಂತ ಹೇಳಿ. ಸೊ ಈ ಪ್ರೌಡ್ಲಿ ಸೇ ದಿಸ್. ಸೊ he is coming up with one book, story book, like ಹೆಂಗಿತ್ತು ಝೂ, how it started and how it is going on, how it is now. So we are giving our inputs ಮ್ಯಾಮ್. in the future if ನಾವು ಅದು ಬಂದ್ರೆ it will be a good message for all the people who know ಮೈಸೂರು ಝೂ. ಹೆಂಗೆ ಇದು ಡೆವಲಪ್ ಆಗ್ತಾ ಬಂತು, ಮತ್ತೆ ಹೆಂಗ್ ನಡ್ಕೊಂಡು ಹೋಗ್ತಿದೆ, ಮುಂದೆ ಏನಾಗುತ್ತೆ ಅಂತಾನು ಕೂಡ ದೇ ಕ್ಯಾನ್ ಎಸ್ಟಿಮೇಟ್ ಮಾಡ್ಕೋಬಹುದು.
ತುಂಬಾ ಜನ ಮೈಸೂರಿನವ್ರು ಇದ್ದಾರೆ, ಐ ಮೀನ್ ಹೂ ವಾಚಿಂಗ್ ದಿಸ್ ಶೋ. ಅಂಡ್ ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಎಷ್ಟು ಡಿಫ್ರೆಂಟ್ ಆಗಿದೆ ನಿಮ್ಮಂತ ವೆಟ್ಸ್ ಹೂ ಆರ್ ಬಿಕಮಿಂಗ್ ಅನ್ ಇಂಟಿಗ್ರಲ್ ಪಾರ್ಟ್ ಆಫ್ ದ ಝೂ ಅಂದ್ರೆ ನಮ್ಗೆ ತುಂಬಾ ಹೆಮ್ಮೆ ಆಗುತ್ತೆ, ತುಂಬಾ ಖುಷಿ ಕೂಡ ಆಗುತ್ತೆ. ಐ ಹ್ಯಾವ್ ಕಪಲ್ ಆಫ್ ಕ್ವೆಶನ್ಸ್. ತುಂಬಾ ಕ್ವೆಶನ್ಸ್ ಇದೆ, ನಾನು ಯಾವ್ದನ್ನ ಕೇಳ್ಬೇಕು ಯಾವ್ದನ್ನ ಕೇಳೋದು ಅಂತ. ಸೊ ಒಂದ್ ಕ್ವೆಶನ್, ವಾಟ್ ಇಸ್ ದ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಆಫ್ ಟಿಪಿಕಲ್ ಗಿನಿ ಪಿಗ್ ಅಂತ ಕೇಳಿದ್ದಾರೆ.
Yeah, usually it's between like 5 to 8, 9 years, and it changes with the captivity and now as a pet, because ಅವು ನ್ಯಾಚುರಲ್ ಆಗಿ ಹೇಗಿರ್ತಾವೋ ಅವುಗಳನ್ನ ಪ್ರೊವೈಡ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಈವನ್ ದೋ ವಿ ಫೀಲ್ we are giving the best of the best, but still I feel like ನನ್ನ ಮಗ ಕೂಡ ನಂಗೆ ಕೇಳ್ತಾನೆ, ಅಮ್ಮ why don't we get a guinea pig, why don't we get a rabbit, it's so small, can we get it? ನಾನು ಅದೇ ಹೇಳಿದೆ, ಸರಿ ಧ್ರುವ, ನಿನ್ಗೆ ಒಂದು ಕೇಜಲ್ಲಿ ಹಾಕಿ ಕೂರಿಸ್ತೀನಿ, I will give all the enrichment for you and all the food, do you think you're gonna enjoy it ಅಂತ. No, and then it's the same thing, amma, I don't want to ಅಂತ. I don't want to confine them to a cage. That's my personal opinion.
Okay.
Yeah.
We have another audience viewer who's asked this question. I have 11-year-old Pomeranian diagnosed with diabetes last year. Insulin twice a day since then. Also had cataract surgery 5 months ago. Any tips on care and what should I be careful about?
Yeah, sure. About this question, ಯಾವ ತರ diet ಕೊಡ್ತಾ ಇದ್ದೀರಾ, that really matters a lot. Is he getting a glucose curve checked, or are you guys checking the glucose every time at home? I mean, ಇವಾಗ ತುಂಬಾನೇ ಬರ್ತಾ ಇದಾವೆ, ಲಾಟ್ ಆಫ್ ಲೈಕ್ ನ್ಯೂ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ ಇದಾವೆ. ಬ್ಲಡ್ ಗ್ಲೂಕೋಸ್ ಮಾನಿಟರಿಂಗ್ ಇದೆ, ವೇರ್ ಯು ಕ್ಯಾನ್ ಪುಟ್ ದ ಪ್ಯಾಚ್ ಇನ್ ಅಂಡ್ ಯು ಕ್ಯಾನ್ ಸ್ಕ್ಯಾನ್ ಫಾರ್ ದ ಬ್ಲಡ್ ಗ್ಲೂಕೋಸ್. ಆಸ್ ಅ ಓನರ್ ಯು ಕ್ಯಾನ್ ಡೂ ದಟ್. ಯು ಕ್ಯಾನ್ ಕೀಪ್ ಎ ಕರ್ವ್, ಹೇಗಿದೆ, ಹೇಗೆ ಕಂಟ್ರೋಲ್ ಆಗ್ತಾ ಇದೆ ಡಯಾಬಿಟೀಸ್ ಅಂತ. ಪ್ಲೀಸ್ ಗೆಟ್ ಯುವರ್ the dog's blood work and urine checked frequently. At least I would recommend once in 6 months. And energy level hegide anta nodi, and change the diet. We have a lot of like a prescription diet right now, like a glycobalance anta ide, amele WD anta ide, diabetic diet anta ide. So they are like formulated. They have done a lot of research to come up with these prescription diets. So definitely you can go for it if he's not, because I don't know if this pet is already on those diets. ಯಾಕಂದ್ರೆ ನಾನು ಮನೆ ಫುಡ್ ಕೊಡ್ತೀನಿ ಅಂದ್ರೆ I am a type 1 diabetic. So whenever I see a lot of diabetic patients in my clinic, ಅವ್ರು ಬಂದಾಗೆಲ್ಲ ನಾನು ಅದನ್ನೇ ಹೇಳೋದು. See, as a diabetic patient, I know how hard it is to control. ನನಗೆ ಎಲ್ಲ ಎಜುಕೇಶನ್ ಇದ್ದೇನೆ, I feel like sometimes I'll give up on it. So it's really hard. And one more thing I wanna let pet parents know before getting a pet, especially ಮಕ್ಕಳಿರೋರು ಅವರೆಲ್ಲನೂ, pets don't live ನಾವು ಇದ್ದಷ್ಟು ವರ್ಷಗಳು ಇರೋದಿಲ್ಲ. That is the hardest thing to digest. And that's one of the emotional thing to go through. I feel like that is a very important concept that we need to understand. They're only part of our family only for a little bit of time. So that we need to understand. They age so fast.
Okay.
That's the biggest thing anybody should understand, because I went through emotionally a lot. I don't have any pets. Nan yav pets bartava, I treat them as my own pets. So I cannot handle, even though I do like 10 to 15 euthanasias per day at my clinic, it's really hard to go through. That's the emotional part that is involved in there. Yeah.
Gangadhar, next question. We have a person asking, few of my friends and family have pets who feed only vegetarian food to them. Is this okay, or do pets need non-vegetarian food as well in their diet?
They do need some non-vegetarian because of the certain amino acids that are lacking in vegetarian food. I have seen a couple of dogs here that didn't do well on just being vegetarian. So yeah, definitely recommend getting them at least the egg, the egg whites, if you can do the meat part of it. So because certain amino acids, especially the sulfur-containing amino acids, are lacking in vegetarian diets. Yeah.
Okay, thank you. Dr. Madan, ನಿಮಗೊಂದು ಕ್ವೆಶ್ಚನು. ಸೊ ಇವಾಗ ಪೆಟ್ ಕೇರ್ ಮತ್ತೆ ಇಲ್ಲಿ ಯುನೈಟೆಡ್ ಸ್ಟೇಟ್ಸ್ ಅಲ್ಲಿ people are more aware about, they're more educated, and they take them to the vet every once in 6 months. ಹಾಗೆ ಇಂಡಿಯಾಲು there's a lot of education. People have changed, they're on par with what's happening here. But I mean, do you still see that? um, how is the vet scenario there? Do people still come and get their pets, or bari ಏನಾರು ಹುಷಾರ್ ತಪ್ಪಿದಾಗ ಮಾತ್ರ ಬರ್ತಾರೆ, ಆ ತರ ಏನಾರು ನೀವು ಡಿಫ್ರೆನ್ಸಸ್ ನೋಡ್ತೀರಾ?
See, if I group our pet owners, I can categorize them according to whatever things you told now. So one group, they're very concerned about their pets. They come and ask how frequently we have to get them checked. There is other group and other side of the thing, they're like, ನಮ್ಮ ಪೆಟ್ಸ್ಗೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಮಾಡಿಸ್ಲೇಬೇಕಾ? ದೇ ಆರ್ ದಿಸ್ ಕ್ವಶನ್. ಸಿ, ಈ ತರ ಎರಡು ಪೇಷಂಟ್ಸ್ ನಾವು ನೋಡ್ತೀವಿ ಇಲ್ಲಿ. ಅಂಡ್ ಅಗೇನ್ ಇಟ್ಸ್ ಅ ಟೀಮ್ ವರ್ಕ್, ಲೈಕ್ ಎವ್ರಿ ಎಲ್ಲರೂ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಐ ಥಿಂಕ್ ಇಟ್ ಮೈಟ್ ಟೇಕ್ ಸಮ್ ಮೋರ್ ಟೈಮ್. See, it's because of the lack of education, I can say, like it's not reaching them. So pet owners ಗೆ ಪ್ರತಿಯೊಂದು ವಿಸಿಟ್ ಮಾಡಿದಾಗ್ಲೂ, ಇಲ್ಲ ಅಂದ್ರೆ if they come across some pet shows or whatever, so if they get to know like how to take care of the pets and how frequently, and out of the way overall, from starting from the vaccination or whatever, till ಅವ್ರ ವಯಸ್ಸಾದಾಗ ಯಾವ ತರ ತಗೊಬೇಕು, how frequently visit ಮಾಡಬೇಕು, what is the importance of blood examination. Even you see, like recently this happened with one is actually a politician like thing, family ಬಂದ್ರು, ಲೈಕ್ ನಾವು ಫಾರ್ ವೆನ್ ವಿ ಆರ್ ಸ್ಕ್ರೀನಿಂಗ್ ಇಸ್ ಅನ್ ಮಾಸ್ಟರ್ ಹೆಲ್ತ್ ಚೆಕ್ಅಪ್. ಸೊ ECG ಮಾಡಿ, ಎಕ್ಸ್ರೇ ಮಾಡಿ, ECG ಮಾಡ್ಕೋಬೇಕು, ಚೆಸ್ಟ್ ಎಕ್ಸ್ರೇ, ಐ ಆಮ್ ಸೀಯಿಂಗ್ ಸಮ್ ಡಿಫರೆನ್ಸ್ ಅಂತಂದಾಗ, is there ECG for pets? See, there's surprising question from them. See, this I don't know whether my other speakers they encounter this at in US ಅಲ್ಲಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡ್ತಾರೆ ಗೊತ್ತಿಲ್ಲ, ಬಟ್ ಇಲ್ಲಿ ನಮ್ಗೆ ಇದು ಫ್ರೀಕ್ವೆಂಟ್ ಆಗಿ ನಮ್ಗೆ ಈ ಪ್ರಶ್ನೆ ಬರ್ತಾ ಇರುತ್ತೆ. ಸೊ ಈ ತರ ಮಾಡ್ತಾರ ಇಲ್ಲಿ, ಈ ತರ ತಗೋತಾರ ಇಲ್ಲಿ, ಒಂದು ಬ್ಲಡ್, ಒಂದು ಸರ್ಜರಿಗೆ ಮುಂಚೆ ಒಂದು ಬ್ಲಡ್ ಟೆಸ್ಟ್ ತುಂಬಾ ಅದಕ್ಕೆ ನಾವು ಸ್ಪೆಂಡ್ ಮಾಡ್ಬೇಕಾ? ಸೊ ಈ ತರ ಕೇಳೋ ಒಂದು ಗ್ರೂಪ್ ಕೂಡ ಇದೆ. ಅಂಡ್ ಅಗೇನ್, ಸೊ ಇದನ್ನ ಡಿಮ್ಯಾಂಡ್ ಮಾಡೋ ಗ್ರೂಪ್ ಕೂಡ ಇದೆ. ಇದನ್ನ ಮಾಡ್ಕೊಳ್ಳದೆ ನೀವ್ ಹೆಂಗ್ ತಗೊಂತೀರಿ, ಲೈಕ್ ಯು ಟು ಡೂ ದಿಸ್ ಅಲ್ಲ ಅಂತ ಹೇಳಿ ಈ ತರ ಒಂದು ಅವ್ರಿಗೆ ಗೊತ್ತಿರೋದು ಇದಾವೆ. It's a mixture of everything, and in next 1 decade or 2 decades, I think so. This will go into public, and they will be aware of everything.
ರೂಪಾ ಮೇಡಮ್, ಐ ವಾಂಟ್ ಆಡ್
Yeah, sure,
ಥಿಂಗ್ ಫಾರ್ ದ
sure.
ಸೇಮ್ ಕಾನ್ವರ್ಸೇಷನ್. ನೀವು ಹೇಳಿದ್ರಲ್ಲ ಇಂಡಿಯಾದಲ್ಲಿ ಹೀಗೆ, ಇಲ್ಲಿ ಎಲ್ಲ ಎಜುಕೇಟೆಡ್. ನೋ, ಐ ಸ್ಟಿಲ್ ಸಿ ಅ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್
Okay,
ದ
good.
ಸೇಮ್ ಸಿಚುಯೇಷನ್ ಇಲ್ಲಿ ಕೂಡ ಬರ್ತಾರೆ.
Mhm.
They don't know why we need to vaccinate. They don't know how to take care of the pets. They don't know anything. They will just buy the pet and just for their emotional support or whatever it is. They don't know anything. It's not about like India or USA situation here. It's about like educating yourself ellidrunu. And other thing is like why it's very important to visit a vet. ಅನ್ಕೋಬಹುದು ಯಾಕೆ ಹೋಗ್ಬೇಕು. It's just like us going to a doctor. ನಮ್ದಾದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ ನಮ್ಗೆ ಗೊತ್ತಿದೆ ಬಾಡಿ ಹೌ ಇಟ್ ಗೋಸ್ ಅಂತ. ನಿಮ್ ಪೆಟ್ದು ಡೆಫಿನೆಟ್ಲಿ ಯು ವಿಲ್ ನಾಟ್ ನೋ ಲೈಕ್ ವಾಟ್ ದೇ ಆರ್ ಗೋಯಿಂಗ್ ಥ್ರೂ ಅನ್ಬಿಟ್ಟು. ಸೊ ವೆನ್ ದ ಪೆಟ್ ವಾಕ್ಸ್ ಇನ್, ಅದನ್ನ ನೋಡಿದ ತಕ್ಷಣ ವಿ ಕ್ಯಾನ್ ಸೇ, ಹೇ, ಇಸ್ ಇಟ್ ಅ ಹೆಲ್ತಿ ಪೆಟ್, ಇಸ್ ಇಟ್ ಸಫರಿಂಗ್, ಇಟ್ಸ್ ನಾಟ್ ಸಫರಿಂಗ್. ವಿ ಕ್ಯಾನ್ ರೀಡ್ ದಟ್. Even though the owner jotele irtare, they could not figure out a lot of things. When they come for a physical exam, it will be surprising for the owner that ಎಷ್ಟು issues ಇದೆ ಅವ್ರ pets ಜೊತೆ ಅಂದ್ಬಿಟ್ಟು. We'll start our exam from the mouth to the tail. It's important, like a dental cleaning, how much it is important. And as they get old, it's especially ನಾವಾದ್ರೆ every day brush ಮಾಡ್ತೀವಿ, but nobody brushes pets teeth. I have seen a nastiest of the nasty teeth. So that's very, very important as they get old. Every year new exam go, the veterinarian will take a look inside the mouth and they will let us know like ಯಾವ amount of tartar ide, what is the thing that you can do. ನೀವೇನಾದ್ರೂ ಬ್ರಷಿಂಗ್ ಮಾಡ್ಬೋದಾ, oral hygiene ಹೆಂಗ್ ಮಾಡ್ಬೋದು, does it need a dental cleaning under anesthesia. So we will educate them. And if you come to ears, there are a lot of pets suffering with the ear issues. ಬರ್ತವೆ, they are very irritated. ಹತ್ರ ಹೋದ್ರೆ ಈ ತರ ಮಾಡುತ್ತೆ, I don't know what's going on. Check the ears. They're so super inflamed. They're so like painful. That could be the reason for his behavior, because he's going through a chronic pain there. And foot pad check ಮಾಡ್ತೀವಿ, skin coat check ಮಾಡ್ತೀವಿ, and the anal glands, a lot of them come with an infection and ruptured anal glands and all that stuff. I mean, these are not emergencies, but if you go to a regular vet visits, we can diagnose all those things. We do express anal glands if they are full. So it's like a total body examination that you get in that vet visit. I think once a year you can spend like whatever, really $35 for a vet exam. So I think that should be okay to do it, and you have to do it. That is the reason, like why we want to do this and bit.
Thank you. It's basically like, ನೀವು ಹೇಳ್ದಂಗೆ, it's more about awareness rather than which part of the continent you are from.
Yeah.
So thank to both Madan and Leela for saying that, and educating our people about pet and
And the other thing I see with educating yourself, they go for Google doctor.
yeah, that's the
ಯಾವಾಗ್ಲೂ.
question I wanted to ask.
Yeah, Google ಹತ್ರ ಹೋದ್ರೆ ನಿಮ್ಗೆ you get a very vague answers for everything. So it's very important to see a veterinarian, get a professional, because we see a lot of pets. ಈಗ ನಮ್ಮ ಹತ್ರ ಬರೋರು ಹೇಳ್ತಾರೆ, ನಾ ಏನಾದ್ರೂ ಹೇಳಿದ್ರೆ ಆ ಬ್ರೀಡ್ ಬಗ್ಗೆ, ಸಿ ಐ ಹ್ಯಾಡ್ ದ ಸೇಮ್ ಕೈಂಡ್ ಆಫ್ ಬ್ರೀಡ್, ಲೈಕ್ ಐ ಹ್ಯಾಡ್ like 7 or 8 ಅಂತ. ನಾನು ಹೇಳಿದ ವಾಲ್ಯೂಮ್ ಆಫ್ ಕೇಸ್ ಐ ಸಿ per year is 5,000 plus, and you're saying you had a 5 pets in these many years. Look at the comparison the people does.
Correct.
Yeah.
That was. I think this question can be addressed by Madan and Kontani. If not, anyone can chip in. My first pet was a street dog in India, for which we gave only rabies vaccination and nothing else. We gave chapati, dosa, idli, rice, bread, and milk. It lived for 16 happy years. But now, with all advancement, I see the dog's life is dropping with strict diet and all vet recommended. Yeah. So what is your opinion on this? Is there any other diet they should follow, or what is your opinion anta kelta idare?
Maybe I feel like it is something to do with the breed also. Nam
ಅದು
local
ಇಂಡಿಯಾ
breeds.
ಬ್ರೀಡ್ ಅಂತ ಹೇಳಿದ್ರು in
ಅದೇ
India.
ನಮ್ಮ local breeds, they are adapted for all those things, and they're
Okay.
not exposed to all. ಈಗ ನಮ್ಮದೇ ತಗೊಳ್ಳಿ, ಹ್ಯೂಮನ್ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಹೇಗೆ ಡ್ರಾಪ್ ಆಗ್ತಾ ಇದೆ. So
Correct.
it's exactly like that with the pets too.
Okay. So
ನೀವು ತುಂಬಾ ಫ್ಯಾನ್ಸಿ ಬ್ರೀಡ್ ತಗೊಂಡು ನಾನು ಚಪಾತಿ ಇಡ್ಲಿ ಹಾಕ್ತೀನಿ ಅದಕ್ಕೆ ಅಂದ್ರೆ, ನೋ, they're not going to take it.
Okay.
They're,
That's
they're not
Dr. Gangadhar, if you have to say
well,
something about
they're
this.
not genetically programmed to that,
Yeah,
because these dogs in
the
India,
breed.
generations have eaten that.
Yep.
So their body kind of gets used to that a little bit. So there are definitely the genetic modifications happening over generations. So these dogs are never exposed to pure vegetarian diets. So
One more thing about the breed, I have seen like a lot of people asking, Leela, ನೀವು ಇಂಡಿಯಾಗೆ ಬಂದ್ರೆ ನಂಗೊಂದು bulldog ತಗೊಂಬರ್ತೀರಾ ಅಂತ. As like people don't know like what bulldogs go through. Each and every system of them is like a misery, I can say. ಪ್ರತಿಯೊಂದು ಐಯಿಂದ ಹಿಡ್ಕೊಂಡು ಮೌತ್, ಇಯರ್ಸ್, ಸ್ಕಿನ್, their GI system, their like respiratory system, heart issues, their back, every single thing is compromised, and people wants to breed just for their cuteness. ನಂಗೆ ಅದು ಬಂದಾಗ ಅವು ಬ್ರೀತ್ ಮಾಡ್ತಾ ಇರೋದು ನೋಡಿದ್ರೆ ದೇ ಫೀಲ್ ಇಟ್ಸ್ ಸೋ ಕ್ಯೂಟ್ ಅಂತ. ಐ ವಾಸ್ ಲೈಕ್, ನೋ, ಯುವರ್ ಪೆಟ್ ಇಸ್ ಸಫರಿಂಗ್. Guys, come on. You need to educate yourself. Oh, I didn't knew that my ಇದಕ್ಕೆಲ್ಲ ಈ ತರ issues ಬರುತ್ತೆ ಅಂತ. So whenever we see the breed, ಅಲ್ಲೇ ಗೊತ್ತಾಗುತ್ತೆ, okay, this is breed related issue ಅಂತ. There are a lot of issues associated with the breed. ನೀವು ಒಂದು breed ತಗೋ ಬರ್ತೀನಿ ಅಂದ್ರೆ make sure you educate yourself about that breed. What are all the diseases they are prone for, issues that they are prone for. ಈಗ small breeds ಬಂದ್ರೆ they are more prone for heart issues. Uh, that is one of the important aspect of why you have to see a vet is they will listen to the heart. See, heart murmur grade 1 in the start ಆಗುತ್ತೆ, then progressively it will get worse and worse. ಕೆಲವರು ಸುಮಾರು ವರ್ಷ ಆದ್ರೂ ಪೆಟ್ಸ್ ನ ಕರ್ಕೊಂಡೇ ಬರಲ್ಲ. They will come at the end stage when the pet goes into labored breathing because of the congestive heart failure. ನಾವ್ ಹೇಳೋದು ಇದನ್ನೇ ನೀವು ಫಸ್ಟೇ ತೋರಿಸಿದಿದ್ರೆ we would have picked up the heart murmur when we examined the heart, and we would have appropriately started the medications and quality of life. That's what I feel. Of end of euthanasia bandaga, that is what they discuss a lot about this. Even nanna Kannada friends kuda, with some of them, they have like a aged pets or ಕೇಳ್ತಾರೆ, when is the right decision to take the euthanasia. ನಾ ಹೇಳೋದು it's a blessing for the pets. See, humans have to suffer alva, there is no option, you have to suffer and you have to go through the disease process. But ಇಲ್ಲಿ ಪೆಟ್ಸ್ಗೆ it's kind of a blessing. It's about the quality of life. You guys know better like ಯಾವ ತರ quality change ಆಗ್ತಾ ಇದೆ. So it's not about like it's about prolonging life but not prolonging suffering. That's what I believe in euthanasia. When it comes to euthanasia, ನೀವು life ನ prolong ಮಾಡ್ತಿದ್ದೀರಾ ಇಲ್ಲ suffering ನ prolong ಮಾಡ್ತಿದ್ದೀರಾ? What is your thing? Just let me know ಅಂತ. So a lot of them will have a hard time during that time. I think we need to talk about this more. I mean, yeah, definitely.
That's a different topic
But this is
altogether.
also comes as a part of the pet care. So
ಹೌದು. And like you can talk on that.
Question, ma'am. So,
yeah.
they mentioned they've given only rabies, and they were very happy to know that it lived for pet lived for all 16 years, I believe. So this and see, there is lot of incidents of this rabies, parvoviral gastroenteritis, and current distemper in India. Severe,
Yeah.
See, I'm really happy that your pet didn't get the
Did not
contact
get
with
it,
disease.
yeah.
It's really good, lucky. But many even the strays, because in the pedigree, the parents are not vaccinated among strays here, so they will not have any passive immunity, right? ಸೊ ಈ ಒಂದು ಸ್ಟ್ರೇ ಅಂತ ತಗೊಂಡಾಗ ಯು ಶುಡ್ ಬಿ ವೆರಿ ರೆಸ್ಪಾನ್ಸಿಬಲ್. ಸ್ಟ್ರೇ ಇದು ನಾವು ಒಂದು ಜಸ್ಟ್ ರೇಬಿಸ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಸಾಕು, ಕಾಸ್ಟ್ ಎಫೆಕ್ಟಿವ್ ಅನ್ಕೊಂಡು ನಾವು ಸೊ ಎಲ್ಲಾ ತರ ವ್ಯಾಕ್ಸಿನ್, ಕಂಪ್ಲೀಟ್ ವ್ಯಾಕ್ಸಿನ್, ಕೋರ್ ವ್ಯಾಕ್ಸಿನ್ಸ್ ಮಾಡಬೇಕಾಗಿ ಬರುತ್ತೆ. ಬಿಕಾಸ್ ಎವ್ರಿ ಡೇ ಐ ಸಿ parvoviral gastroenteritis and current dysentery in my clinic.
Correct.
So
And
that
lepto
most
too.
of
I
them
don't
are
know about
strays.
the lepto, Dr. Madan. Do you guys get a lot of
ಲೆಪ್ಟೋ ಇದೆ
lepto?
ಮ್ಯಾಮ್, ಲೆಪ್ಟೋ ಇದೆ. ಸೊ ದಿಸ್ ಇಸ್ ಮೋರ್ ಕಾಮನ್ಲಿ ಐ ಸಿ ಅಮೌಂಗ್ ದಿ ಸ್ಟ್ರೇಸ್, ಸ್ಟ್ರೇ ಪೆಟ್ಸ್ ಅಲ್ಲಿ ತುಂಬಾ ಕಾಣಿಸ್ಕೊತಾ ಇದ್ದಾವೆ. ಒಂದ್ಸಲಿ ಇದು ಬಂದಾಗ ಮಾತ್ರ ವ್ಯಾಕ್ಸಿನ್ ಈಗ ಕೊಡ್ಬೋದಾ ಅಂತ ಹೇಳಿ, ನೋ ಯು ಕಾಂಟ್ ಅಲ್ಲ. ಸೊ ನಾ ಹೇಳೋದು
ಬೇಗ
ವೆದರ್ ಇಟ್
spread
ಇಸ್
ಆಗುತ್ತೆ ಇದು.
ಸ್ಟ್ರೀಟ್ ಡಾಗ್ ಆರ್ ಅಂಡ್ ಸ್ಟ್ರೇ, ಸೊ irrespective of anything, consider vaccination, so we can avoid many diseases. So
Yeah, a lot of people
yes,
think going to a vet is like adding to their business. Anta. No, we are not here for business. We truly care for your pets. That's why we are here.
and again, ma'am, ಇನ್ನು worst case ಅಂತಂದ್ರೆ I have seen people, they're concerned about vaccinating dogs but not stray cats. Very less
No,
people
here
they
too,
come
Madan.
forward to get the vaccination in stray cats.
Even in USA also, they always neglect cats. ಕರ್ಕೊಂಬರಲ್ಲ yearly vaccine. Our first year vaccination ಆದ್ಮೇಲೆ, we see the cats when they come for euthanasia. That's the only time we see them. It's a lot of incidences we see like that. Yeah.
Yes. So this myth has to go, like only thorough breeds has to be or well bred and
Vaccinated. Yeah.
breed
Yeah.
vaccinate ಮಾಡಬೇಕು, ನಮ್ಮ stray or ಇದನ್ನ ಮಾಡಬಾರದು
No, a
ಅಂತಿಲ್ಲ.
lot of stray dogs. I have seen actually ನನ್ನ own stray pets and I have lost because of the canine distemper and parvo and all that stuff.
One question ಇದೆ. People say that there are human ears and dog ears, and that one dog ear is 3 or 4 times a human. It's humans. Is that true?
It's breed related. The larger breeds, the larger breeds are a shorter thing, whereas the smaller breeds live longer. So it ranges from 3 to 7. Yeah. The first 2 years again can be up to 3 or 4. After that, it slows down. But again, it depends on the breed. A Great Dane would live only 7 years, so we can't really compare by goes by breed. Yeah.
There is one of our viewers thanking all of you. He says, being a vet is a thankless job. Poor pets can't speak or complain. Thanks to you all. So he just wanted to say.
Yes, sure. We are the voice for the voiceless.
Yes,
For
that's
sure.
what.
Yeah.
And Dr. Madan, recently Mysore Zooli, you did some surgeries or on leopards and a baby female tiger delivered cubs anta. Adar ಬಗ್ಗೆ ಏನಾರು do you want to emphasize or explain on
I
that?
was mentioning about how I entered Mysore Zoo, like how I never thought during my studies, ನಾನು ಓದ್ಬೇಕಾದ್ರೆ ನಾನು ಯಾವ ರೀತಿ ನಾನು ವೈಲ್ಡ್ ಲೈಫ್ ಅಲ್ಲಿ ಇಂಟರ್ ಆಗ್ತೀನಿ ಅಂತ ಹೇಳಿ ನೆವರ್ ಹ್ಯಾಡ್ ದಟ್ ಥಾಟ್. So the situations forced me, like they invited me for a tiger procedure. So I witnessed and I developed that interest over, um, wildlife practice. So since now, ma'am, I crossed about 350 surgeries in Mysore Zoo. All are like wild animals. ಸೊ ರೀಸೆಂಟ್ ಅಂದ್ರೆ ನೀವು ಕೇಳ್ತಿದ್ದಾಗ ಡಿಸ್ಟೋಕಿಯಸ್ ಕಾಮನ್ ಅಂತ, ಡಿಸ್ಟೋಕಿಯಾ ಅಂತಂದ್ರೆ ಸೊ ಬರ್ತ್ ಕೊಡೋದು, ಅಂದ್ರೆ ಬರ್ತ್ ಕೊಡ್ಬೇಕಾದ್ರೆ ಡಿಫಿಕಲ್ಟಿ ಆಗತ್ತಾ ಅಂತೇಳಿ. ಸೊ ದಿಸ್ ಇಸ್ ದ ಇನ್ಸಿಡೆನ್ಸ್ ಆಫ್ ಡಿಸ್ಟೋಕಿಯಾ ಇಸ್ ವೆರಿ ಲೆಸ್ ಅಮಂಗ್ ವೈಲ್ಡ್ ಲೈಫ್. This is because of less human intervention.
Human intervention.
In their reproduction status or whatever, it's because of less human intervention. There is no dystokias in I encountered very very little, like very very less cases. So on the example kuda adre leopard, so that's because of some social group alli problem agi avadu that individual female, so she had some difficulty in maturitating, so we took her for cesarean section. And when it comes to herbivores, like ನಾವು ಹಸುಗಳಲ್ಲಿ ನಾವು ಒಳಗಳು ತುಂಬಾ ನೋಡ್ತೀವಿ, ನಾವು ಕರು ಈಚೆ ಬರೋದಿಲ್ಲ, ಡಿಫಿಕಲ್ಟಿ ಆಗೋದು ತುಂಬಾ ನೋಡ್ತೀವಿ. ಬಟ್ ಇನ್ ಸರ್ಪ್ರೈಸಿಂಗ್ಲಿ ಇನ್ my wildlife career, I have encountered not even like 1 or 2 cases of dystocia among herbivores. ಅಂದ್ರೆ ಹಸುಗಳ ಜಾತಿಗೆ ಸೇರಿದಂತ ಇದರಲ್ಲಿ ಒಂದೆರಡು ನೋಡಿದ್ದೇನೆ ಅಷ್ಟೇನೆ. Because they're natural, they really do well, like no complications in their natural delivery ಆಗೋದ್ರಲ್ಲ. ನೆಕ್ಸ್ಟ್ ನೀವು ಈಗ ರೀಸೆಂಟ್ಲಿ ದಿಸ್ ಇಸ್ ನಾಟ್ ಇವನ್ ಗಿವನ್ ಔಟ್, ವಿಷಯ ಈಚೆ ಹೋಗಿಲ್ಲ ಝೂ ಇಂದ, ಲೈಕ್ ದೆರ್ ಇಸ್ ಫಾರ್ 3 ಕಪ್ಸ್ ಟೈಗರ್ ಕಪ್ಸ್. ದಟ್ ಇಸ್ ದ 4th day ಆಕ್ಚುಲಿ. ತಾರಾ ಅನ್ನೋ ಒಂದು ಫಿಮೇಲ್ ಟೈಗರ್ ಲಿಟರ್ ಮಾಡಿದೆ. ಸೊ ಇನ್ನು ನಾವು ಎಲ್ಲೂ ಡಿಸ್ಕ್ಲೋಸ್ ಮಾಡಿಲ್ಲ. ಸೊ ಸ್ಟಿಲ್ ಇನ್ ಅಬ್ಸರ್ವೇಷನ್, because the fetal mortality is always seen in philids. So just we are observing them. So everything is well, she is feeding well, everything all fine. So no hinge she will take care of anteli.
That's
no add on of this. Yes, yeah.
Innondu question ittu, some people are asking questions on 1 meal a day for your pet. Is that good, or it depends on the breed or age, or hege? Dr. Gangadhar.
The smaller breeds need to be fed more often. I think 2 meals a day is ideal. Typically, and keep it 12 hours apart. A lot of times we see when they feed 1 meal in the morning, by next day morning, the stomach's been empty for a long time. They tend to get acid reflux, and we see the dogs throwing up bile first thing in the morning. That's because the stomach's been empty for so long. So it's always best to feed them twice a day. And again, depends on the breed too. Smaller breeds definitely need to be fed more often. Their metabolic rate is higher.
And even with the
level 2.
This, Dr. Gangadhar, if you want to mention about the larger breeds predisposing to the GDV cases,
Oh, yeah,
but
right.
they need to be very careful, like feeding a larger
The deep
male
chest.
and letting them play. Stomach bloat agutte. That's like an emergency. Within few hours, they can die of that. If you don't recognize, they will start drooling, especially deep-chested dogs, so big
Collies,
dogs.
Shepherd Shepherds, Great Danes,
Yeah.
any of the bigger breeds with a deep chest, because there's a lot of room around the stomach. So after eating, if you exercise them, or after a big exercise, they come back, they eat a lot or drink a lot, then the stomach can not only get bloated because of the food in there, and sometimes exercising like that, the stomach will rotate on itself. So it's called GDV, gastric dilatation volvulus complex. And it's an emergency. It needs to be addressed right away. Otherwise, you'll lose the dog. Or they will go through splenectomy because of the blood vessels being blocked. And it's definitely a bigger complication. And
Yeah, it's a
people
very,
with
very
M,
big complication.
people with deep-chested dogs can also prophylactically get gastropexy, wherein
Yeah.
we attach the wall to the side of the abdomen, to chest, and that way it doesn't really rotate, as a preventive measure.
So as a spay, ಇವಾಗ spay ಮಾಡಿಸ್ಕೊಳಕ್ ಹೋಗ್ತಾರಲ್ಲ big dogs. So that
That's
time
right.
we can with the spay we can fix the stomach to the body wall so that the bloat ಆದ್ರೂ twist ಆಗಲ್ಲ. Twist ಆದ್ರೆ it compromises all the vascular supply to the heart and everything. It's a more major complication ಆಗುತ್ತೆ. Bloat ಆದ್ರೆ at least we can pass a stomach tube and relieve the gas immediately. So the spay ಮಾಡಿದಾಗ please ask for a gastropexy if you have a bigger dog. Like a large breed, deep-chested dogs, go for it.
Okay, we have another question, Gangadhar, for you.
Sure.
Dr. Gangadhar, sorry. For dogs, what kind of physical activities do you advise? In US, every food is branded and each brand has its own advantages and disadvantages. So what do you recommend?
Right. Well, activities, I mean, definitely play with your dog. If you have multiple dogs, take them out for walks. And again, depends on the breed too, because there are certain dogs that need a lot of exercise. If you have a Labrador, if you have a Golden Retriever, or any of the bigger dogs that are sporty breeds, they do need, and especially the Australian Shepherds, and they didn't wear a lot of exercise. If you don't give them the exercise, they're not going to be a good pet at all, because they're always wired, because they want to be on the go. So they do need all that exercise. Exercise can be walks, play, ball, throw ball, or swimming, or whatever you can afford, but definitely need that exercise. Yeah. So as far as the diets, there's so many brands available.
Yeah.
Everybody claims they are the best. So, so I would go with a company that has done some research, has done some feeding trials on pets, because in the US, at least, there's AFCO, which is a
nutrition
body,
branding.
regulatory body, but it's not a government body. It's the members of the pet food industry made themselves the body so they can regulate themselves. So really, there is no control on. So they just list the ingredients, and you have, as long as you have minimum protein or minimum thing, that's all they care for. They don't say what the maximum is, or that's why the labeling system is very poor. So really don't get a scientific number or scientific proof or whatever of the quality of the food. So that's why you want to go with the company that does research, feeding trials, and that way you can compare apples to apples. And also, when you're looking for it, look for it on a dry matter basis. Don't just go by minimums, because if you can call the company, they'll tell you exactly what the percentage is on a dry matter basis. That's your ideal way of comparing foods. Yeah.
Adding some points to this one, I recently attended like a cardiology seminar. They were talking about the grain-free diet and the peas and everything. Please, there is an association between the grain-free diet and the cardiac disease and the peas. Especially, they compare a lot, like a huge number of studies. Peas-based diet ಏನಿದೆ, if it is a maximum of a peas, I know a lot of pet foods do have peas in it. So be careful with that. They did see some association with that. So
Okay.
Not every dog needs grain-free diet. I mean, if you have allergies, you can try it, but make sure they add the amino acids that they need, taurine, added to the diet. Otherwise, they get HCM, which is the cardiomyopathy,
Yeah.
which can be a problem for them.
We have another question. Recently, I see holistic chews for dogs with ingredients such as turmeric, clove, and cinnamon. Is it okay to add these ground spices to their food?
Lately, I've seen more turmeric coming into veterinary
Yeah.
field, which is okay. I think it's an antioxidant, so it's okay. But
As
again,
long as it is
how
not
much
too much,
how
right?
much are you going to add? That's still
Yeah.
debatable. What is the effective dose? We don't know that yet. So, yeah.
So I
Cinnamon
see
and
one more. I
the
see-
other thing, the other ingredients they were talking about was cinnamon and what was it? Or, I would avoid cinnamon for sure. Yeah.
We have some of our audience who are funny.
I know. I saw that some rice and make chitrana. Yeah, I saw one more thing that I wanted to mention when I was discussing about GDV, like dog toys.
Ah,
So please be careful with the toys. Ella ತರ fancy toys na ತಗೊಂಬಂದು ಅಲ್ಲಿ ಹಾಕಿ they will rip and they will eat, and we see a lot of like a GI obstruction cases. It's not funny, guys. ನಾನು ಪ್ರತಿ ಸಲ ಅದೇ ಹೇಳೋದು, oh my god, this toy is so cute, this ಚೆನ್ನಾಗಿದೆ ತಂದ್ಕೊಟ್ಟೆ. Yeah, this is where you are gonna end up after that. Like, be careful. If your dog is like ಅದನ್ನ ರಿಪ್ ಮಾಡುತ್ತೆ ಅಂತ ನಿಮ್ಗೆ ಗೊತ್ತಿದ್ರೆ, please don't give it. It's not fun. A cards chew ಮಾಡೋದನ್ನ funny ಅಂತ ಹೇಳ್ಕೊತಾರೆ. No, it's not funny, because we see those cases like tongue ಪೂರ್ತಿ burnout ಆಗಿರೋ cases. So we see a lot of GI obstruction. ಒಂದು ಎರಡು ಅಲ್ಲ, ಮ್ಯಾಕ್ಸಿಮಮ್ ಲೈಕ್ 3 ಸರ್ಜರೀಸ್ ಅದಾದ್ಮೇಲೆ ಎಲ್ಲ ಅಡಿಷನ್ಸ್ ಸ್ಟಾರ್ಟ್ ಆಗಿರುತ್ತೆ ಒಳಗಡೆ. ವೆನ್ ವಿ ಓಪನ್ ದ ಅಬ್ಡಮನ್, ದರ್ ಇಸ್ ನೋ ಲೈಕ್ ಹೆಲ್ತಿ intestinal part to take it off. We have seen very, very complicated cases with the GI obstruction with these toys, especially getting into like socks. So those are the major things. ಚಿಕ್ಕ part ಇರೋದು, ಆಮೇಲೆ ಕಾರ್ಪೆಟ್ ನ ರಿಪ್ ಮಾಡಿ ಆ ಸ್ಟ್ರಿಂಗ್ಸ್ ನ ತಿಂದಿರ್ತವೆ. There are like spoons, forks.
Pantyhose.
We see a lot of different cases. So be careful. Puppy proof ಮಾಡೋದು ತುಂಬಾ ತುಂಬಾ important ಮನೇನ, especially the dustbins. They get into a lot of like tampons. So these are really common cases that we see all the time. They come in and they spend a lot of money for the emergencies. So be careful with the things that your pets are getting into.
Dr. Leela, continuing with that, intelligent toys anta baruttala. I mean, like puzzles and stuff like
Puzzles.
that. Or, yeah, is that okay? Because my dog does one of those puzzles too.
No,
So,
as long as they cannot like break it into small pieces and ingest them, that should be fine.
okay. And Dr. Gangadhar, I mean, after the show, if you can just put in our Facebook page the best insurances so far for our viewers, that'll be helpful. I mean, whatever you consider is at best, you and Dr. Leela, anyone can post in this, on the Facebook page. That'll be helpful. I have another question. It says, by neutering and spraying pets, especially dogs, will they have any long-term effects on pets due to hormonal deficiency?
So I can talk about spay, especially. I wanted to educate all the pet owners about spay. Please do spay your female dogs. It's really important. I see, as an emergency vet, I see a lot of mammary tumor cases, a lot of pyometra cases. Again, they're all life-threatening, especially pyometra, where the uterus will be filled with the pus. And especially if spay madilla andre, it's very, very common. So a percentage of getting a pyometra case pyometra is really high. And mammary tumors, tumbane, they are predisposed. Actually, if you don't spay them, because of the hormones and everything, they can get mammary tumors, and most of them are very aggressive irutte, matte it will go into chest and different organs, and finally ಅವರು ನಮ್ಮ ಹತ್ರ ಬರೋ ಅಷ್ಟೊತ್ತಿಗೆ it will be like beyond our
Oh, yes.
yeah. So
Yeah.
To add to,
neuter.
to add to that, go ahead.
No,
To
no.
add to that,
Yeah.
the thing was that we always paid and neutered them by 6 months. Lately, they're coming out with waiting
Yeah.
for till they're
Once.
18 months old, because what's happening is with the hormones, the bones get stronger, the ligaments get stronger, less incidence of arthritis and
Yeah.
ACL tears as they get older. So I'm all for it for the male dogs. The females, again, I'm not so sure, but mainly thing with the priming of the tissues from the estrogen every time they go in heat. So I'm still recommending, again, it's my personal thing, to spay the females earlier, but the males can wait till 18 months.
Yeah, I think that is the current recommendation too. Like first heat cycle gogokinta ಮೊದಲೇನೆ it's better to take the uterus off, because ಒಂದೊಂದು heat cycle ಹೋದಷ್ಟುನು they're more predisposed to all these issues. Male dogs, I think we can wait like 1 year to 15 months, and you can get it done. Because as I said, the females ಅಲ್ಲಿ spay ಮಾಡಿದ್ರೆ ಏನ್ ಪ್ರಾಬ್ಲಮ್, ಅದೇ ತರ males ಅಲ್ಲಿ also they have cases like they come up with the prostate cancer agli. There are a lot of issues like a testicular tumors. They're also pretty aggressive. We see a lot of them in emergency too. So
Perianal
better
tumors.
to get them neutered. Yeah.
Dr. Madan, ನಿಮ್ಗೆ next question. How is the food, like pet food, evolved in India ಇವಾಗ? Like, is it more accessible these days, or ಹಿಂಗೆ how are things back there?
It's nice and it's available. Like most of them are aware of it, and yes, it's available everywhere. Not in every village they are getting this, food, And I say during this Corona time, like I encountered this episodes with especially the Persian cats. So they were roving for particular feed, pattern, the variety of the, even in Royal, example, if I take in Royal Canin, they want particular variety in that. Otherwise, that cat won't eat at all. And see, ಇದು ಯಾಕೆ ಈ ತರ ಆಗತ್ತೆ ಅಂತಂದ್ರೆ ಅವರು ದೇ won't practice the homemade diet at least once in a day, once in a day at least some meat ನ ಫೀಡ್ ಮಾಡೋದಾಗ್ಲಿ, ಒಂದು ಎಗ್ ಬಾಯ್ಲ್ಡ್ ಎಗ್ ನ ಫೀಡ್ ಮಾಡೋದಾಗ್ಲಿ, ಅದನ್ನು ಮಾಡೋದಿಲ್ಲ. ಸೊ ಇದನ್ನ ಏನಾಗಿರುತ್ತೆ, ಲೈಕ್ ಬಿಕಾಸ್ ಆಫ್ this practice, they won't eat anything, even they'll fast for 3-4 days. So what happens is the whole family will be restless. Then they come that this feed is not available. So because during Corona time, like all the shops were shut. So that was a difficult time. I used to take this an example for each and every patient, So at least let them have the access to, let them be practiced with 2 or 3 types of feed regimen, so that it will be easy for you to control in the time of some scarcity or whatever in some different situations. So, but all the feed are available, ma'am. All the scientific diet, prescription diets, regular diets, so there, even the people are aware of it. That's going on.
Okay. So thank you. So like it's more, I mean, cost wise also it's, it's
Yeah,
not that expensive
they're
also.
affordable. They're doing it. Yes.
Oh.
To add on to the foreign body, the gastric foreign body, what I was telling you, So I have a few funny stories, ಬರ್ತಾರೆ, they will bring the, actually this incident happened between the 3 months, 2-3 months in the ಹಿಡಿದು 1 ವರ್ಷ ತನಕ ಈ incidents is more, because adult dogs, like elderly pets, they know how to, they judge between which is consumable, which is not. But the time between 2 to 3 months till 1 year, they feed on everything. The socks, one day they came, the needle table ಮೇಲೆ ಇಟ್ಟಿದ್ದೆ ಕಾಣ್ತಾ ಇಲ್ಲ,
I know.
ನನಗೆ
I
ಇವ್ರಿಗೆ
know.
ಡೌಟ್ ಇದೆ. Okay, so we take one X-ray and I saw the needle in the stomach. I told them you have to take him to the surgery immediately. Surprisingly, our needle jotege, we got in plastic cap, 2 socks and 1 biscuit packet cover. All were there, which was, it is a radiolucent ಇದು ನಮಗೆ X-ray ಅಲ್ಲಿ ಕಾಣೋದಿಲ್ಲ. See, ಈ ತರ ತುಂಬಾ, see, pen caps and ಮನೆಯಲ್ಲಿ ಬಂದ್ರು, so what ಹೆಗರ್ದ ಅವ್ರ ಮೇಲೆ ಕೀ ಚೈನ್ ಡ್ರಾಪ್ ಆಯ್ತು, ನುಂಗ್ಬಿಟ್ಟ.
Yeah, we see
See, we
all
have
different kind of
every at least 2 or 3 cases in a week, So ಮನೆಯಲ್ಲಿ ಏನೇ ಕಾಣಿಸದೆ ಹೋದ್ರು ಕೂಡ ಈ ತರ ಒಂದು ಈ ಏಜ್ ಅದು ಒಂದು ಪೆಟ್ ಮನೇಲಿ ಇದೆ ಅಂತಂದ್ರೆ ಯು ಶುಡ್ ಸಸ್ಪೆಕ್ಟ್ ಇವನ್ ಏನೋ ಮಾಡಿರ್ಬೋದಾ ಅಂತ ಹೇಳಿ. ದಟ್ ಒನ್ ಸಿಂಪಲ್ ಅಬ್ಡಮನಲ್ ಎಕ್ಸ್ರೇ ವಿಲ್ ಗಿವ್ ಯು ದ ಕ್ಲೂ, ಲೈಕ್ ಏನಾದ್ರು ಇದೆಯಾ ಇಲ್ವಾ ಅಂತ ಹೇಳಿದ್ರೆ ನಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಯಾಕಂದ್ರೆ ಎನಿ ಫಾರಿನ್ ಬಾಡಿ, if it is not completely obstructing the intestine or this one, if it is partial obstruction ಇದೆ ಅಂತಂದ್ರೆ first 3 days clinical signs ಕಾಣೋದಿಲ್ಲ. 3 to 4 days, it may go up to months also. I've seen some plastic object even in a month, just body weight ಕಮ್ಮಿ ಆಗ್ತಾ ಇದೆ, ಸ್ಲೋ ಅನಿಮಿಕ್ ಇದೆ, ಬಟ್ ಅನಿಮಲ್ ಆಕ್ಟಿವಿಟಿ ಏನೋ ತೊಂದರೆ ಇಲ್ಲ, ಏನೋ ಆಗಿರೋದಿಲ್ಲ. ಬಟ್ ಸೊ ದಿಸ್ ಇಸ್ ದ ಟೈಮ್ ಇಟ್ ಕನ್ಫ್ಯೂಸಸ್, ಸೊ ಒನ್ ಈ ತರ ಏನೋ ಡೌಟ್ಸ್ ಇದೆ ಅಂತ ಅಂದಾಗ ಪೆಟ್ ಓನರ್ಸ್ ದೇ ಮಸ್ಟ್ ಟೇಕ್ ದೆಮ್ ಟು ನಿಯರ್ ಬೈ ಹಾಸ್ಪಿಟಲ್ ಅಂಡ್ ಒನ್ ಜಸ್ಟ್ ಸ್ಕ್ಯಾನ್, ಒನ್ ಬಾಡಿ ಸ್ಕ್ಯಾನ್ ವಿಲ್ ಗಿವ್ ದ ಕ್ಲೂ ಏನಾದ್ರು ಇದೆಯಾ ಇಲ್ಲ ಅಂತೇಳಿ. ಸೊ ತುಂಬಾ ಮೇಜರ್ ಇಶ್ಯೂನ ನಾವು ಮುಂಚೆನೆ ಅವಾಯ್ಡ್ ಮಾಡ್ಕೋಬಹುದು ಈ ತರ ಮಾಡೋದ್ರಿಂದ. So
one more thing,
proof ಮಾಡೋದು ಇಟ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಈ ತರ ಫೇಲ್ ಆಗೋದ್ರಿಂದನೇ ಈ ಎಪಿಸೋಡ್ಸ್ ನಾವು ಪದೇ ಪದೇ ನೋಡ್ತಾನೆ ಇದೀವಿ. ಐ ಥಿಂಕ್ ಇಟ್ ಡೋಂಟ್ ಸ್ಟಾಪ್, ತಿರ್ಗಾದ್ರೆ ಆಗ್ತಾನೆ ಇರುತ್ತೆ ಅಂತ ಅನ್ಕೊಂತೀನಿ.
Yeah,
Yeah.
adding on to this, one more important thing I want to just let the pet owners know and be aware of it is the toxicity, toxin exposures. Especially ನಿಮ್ಮ ಮನೇಲಿ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಆ ಥರ ಏನಾದರೂ ಡ್ರಗ್ಸ್ ಇದ್ರೆ ಪ್ಲೀಸ್ ಪಪ್ಪಿ ಪ್ರೂಫ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಐ ಹ್ಯಾವ್ ಸೀನ್ ಟನ್ಸ್ ಆಫ್ ಕೇಸಸ್ ಕಮಿಂಗ್. ನಾನು ಅಲ್ಲಿ ಮಾತ್ರೆ ಇಟ್ಟಿದ್ದೆ ತಗೊಳ್ಳೋಣ ಅಂತ ಅನ್ಕೊಂಡೆ, ಅಷ್ಟರಲ್ಲೇ ತಿನ್ಬಿಡ್ತು. ಅಂಡ್ ರ್ಯಾಟ್ ಪಾಯ್ಸನಿಂಗ್, ಲಾಡ್ ಆಫ್ ರ್ಯಾಟ್ ಪಾಯ್ಸನಿಂಗ್ ಬರುತ್ತೆ. ಪೆಸ್ಟಿಸೈಡ್ಸ್ ಎಸ್ಪೆಷಲಿ ಲಾನ್ ಸ್ಪ್ರೇ ಮಾಡಿದಾಗ ದೇ ವಿಲ್ ಗೆಟ್ ರಿಯಲಿ ಸಿಕ್. ಸೊ ಬಿ ಕೇರ್ಫುಲ್. ಅದು ಲಾನ್ ಸ್ಪ್ರೇ ಮಾಡಿದಾಗ ಏನ್ ಪ್ರೋಟೋಕಾಲ್ ಇದೆಯೋ ಫಾಲೋ ಮಾಡಿ. It's very toxic to them. And plants, so there are a lot of plants which are toxic to pets. House plants, so be careful. Make sure that you know like yav plants ide, yav pet tarta idira, is it really safe? So make sure. We see a lot of these cases, so just I wanted to make sure that you guys are aware of it.
Especially cats and lilies.
Yeah, lilies, they're very toxic.
I have another question. I mean, ಎಷ್ಟೊಂದಿದೆ. I don't even know if we'll have time to answer all of them, but
One thing I would insist on everybody is don't give bones to your dogs. Big problem. Especially chicken bones, they splinter, and we've seen so many penetrating through the esophagus, and really not much you can do unless you get it out quickly. So be
So
aware.
one more adding on to the bones, idu round agiddu chikkadag piece cut ಮಾಡಿರ್ತಾರಲ್ಲ bones. I have seen like the lock in the jaw. I have seen many of them. ಬರುತ್ತೆ ಫುಲ್ಲು ಪೆಟ್ ಹೇಗೆ ಅಂದ್ರೆ ಲಾಕ್ ಮಾಡ್ಬಿಟ್ಟಿರುತ್ತೆ. ಬಾಯಿ ಮುಚ್ಚಕ್ಕಾಗಲ್ಲ, ತೆಗಿಯಕ್ಕಾಗಲ್ಲ. We have to take a saw and trim the bone and cut the bone and make it into pieces. ಆಮೇಲೆ fish hooks. We see a lot of fish hooks getting into their paws, ಮತ್ತೆ ಸ್ಕಿನ್ಗೆ, ಮೌತ್ಗೆ. They're all like emergency cases. I see a lot of them, so that's why I'm coming up with all those things. Like these are all now ಅನ್ಕೊಂಡೇ ಇರಲ್ಲ ಈ ತರ ಆಗುತ್ತೆ ಅಂತ, but these are all possible.
There's a question about antler horns. Don't use them.
Yeah.
I've seen dogs chip their teeth. They break their teeth because the antlers are stronger than the teeth. The enamel's gone within a matter of days, especially the chewing on antlers. And
especially bones chew ಮಾಡೋದ್ರಿಂದ I do a lot of dentals too. Major bones in the teeth ಏನಿದೆ ಸ್ಟ್ರಾಂಗ್ ಆಗೇ ಇರುತ್ತೆ, ಬಟ್ ಅಲ್ಲಿ ಫ್ರಾಕ್ಚರ್ ಆಗಿರುತ್ತೆ. ಸೊ ಐ ಹ್ಯಾಡ್ ಟು ಎಕ್ಸ್ಟ್ರಾಕ್ಟ್ ದ ಟೀತ್. ದರ್ ಇಸ್ ನೋ ಅದರ್ ವೇ. ಯಂಗ್ ಆಗೇ ಇರುತ್ತೆ, 2-3 years ಇರ್ತವೆ. ಬಿಕಾಸ್ ಆಫ್ ಆಲ್ ದೀಸ್ ಹಾರ್ಡ್ ಆಬ್ಜೆಕ್ಟ್ ನ ಬೈಟ್ ಮಾಡಕ್ ಹೋಗಿ ದ ಫ್ರಾಕ್ಚರ್, ಅಂಡ್ ವಿ ಹ್ಯಾವ್ ಟು ಟೇಕ್ ದ ಟೀತ್ ಆಫ್. ದರ್ ಇಸ್ nothing more we can do. I mean, you can consult a dental specialist, but it will add on too much of cost to you guys. So be careful. Try to avoid all these things so you can avoid a lot of things. I have some
example, chew bone recently happened in my hospital. Like it is lodged in thoracic esophagus.
Yeah, I know.
So
it's such a difficult place to remove it too. So it's not easy on us.
But
and one more thing, the interesting thing that even I never imagined that a pet can get into, it's a puppy hanger iruttalla, batte hako hanger. A hanger du purti hogi esophagus large agide. We had to open the esophagus to get that out. So that was like, nan imagine kuda madkonilla hanger na tara tinnutte puppy anta. So be careful. They can get into anything.
Yeah, almost time after we have like 5 minutes more. Adkinta munche I have couple of one question and one question to Dr. Madan as well. Dr. Madan, do you want to share any details about the Mysore Zoo and how they take care of animals, etc.? Like what are your biggest pluses and what are your biggest negatives, and how we can, any help you need, or like what is the best that we as a Kannadiga and lovers of Karnataka and Mysore can do anta yarobru question kelidare. It's an audience question. Yeah.
Again, I utilize this platform to thank some society called as Pampa Kuta, right?
Pampa Kannada
right?
Rupa
Yes,
Global Kannadiga.
During crisis, like Mysore Zoo faced economical crisis during Corona.
Oh yeah,
because
it's Pampa Kannada Kuta they sponsored. Yeah.
Yes, they sponsored some amount, that helped us really. Again, ma'am, so you're talking about these developments, right?
Yeah,
positives,
yeah.
Okay. So as you know, ನಮ್ಮ Wildlife Act ಅನ್ನೋದು Indian Wildlife Act ಅನ್ನೋದು is bit different when it comes to other nations. So ನಮ್ಮಲ್ಲಿ ಹೆಂಗೆ ಅಂತಂದ್ರೆ conservation, it is going in a peak, like ಈಗ ನೀವು tiger conservation ನೋಡಿರ್ತೀರಿ. So recently, to give an example, there was one tiger. Even I gave an interview for an US based journal. um, the tiger is from Madumalai tiger reserve from Tamil Nadu. Okay, so it became so famous because the Chennai High Court given an order to capture him alive rather killing him. He was a manhunter. So this one order from court, it had, ತುಂಬಾ ಜನಕ್ಕೆ ಇದ್ರ ಮೇಲೆ like they developed the interest. So ಯಾಕೆ ಈ ತರ ಇದೆ, ಯಾವ ತರ ಇದೆ ಅಂತ ಹೇಳಿ. So successfully this Tamil Nadu Forest Department capture ಮಾಡಿದ್ರು after like 1.5 month of tracking. 1.5 ತಿಂಗಳು 9 vets, 9 ಜನ vets, 9 ಗ್ರೂಪ್ ಮಾಡ್ಕೊಂಡು ಅವನನ್ನ ಟ್ರ್ಯಾಕ್ ಮಾಡಿ. So he was in such a condition that ಅವನ ಕ್ಯಾಪ್ಚರ್ ಮಾಡಿದ ದಿನ ಅವನಿಗೆ there are multiple maggot infested wounds. ಯಾಕೆ ಐ ವಿಲ್ ಟೆಲ್ ಯು ವೈ ಆಮ್ ಟೆಲಿಂಗ್ ದಿ ಸ್ಟೋರಿ. ಸೊ ಥ್ರೂ ಔಟ್ ದ ಇದು ನೋಸ್ ಲೆಫ್ಟ್ ನೋಸ್ ಸ್ಲಿಟ್ ಆಗಿದೆ. ಓಕೆ, ಅವನ ಕೈ ಒಂದು ರೈಟ್ ಐ ಇಸ್ ಪಾಪ್ಡ್ ಔಟ್. ಇಸ್ ಸ್ಲಿಟ್ ಇನ್ ದ ಏನೋ ಕೆಳಗಡೆ ರೆಪ್ಪೆ ಕಟ್ ಆಗಿದೆ ಅವನಿಗೆ. ದರ್ಸ್ ಲಾಟ್ ಆಫ್ wounds. He was in very very bad condition. ಸೊ ಇದೇನಾಯ್ತು, ಇಟ್ ವಾಸ್ ಇನ್ ಮಧುಮಲೈ. ದಟ್ ಮೈಸೂರು ಝೂ ಇಸ್ just 3 kilometers from ಮಧುಮಲೈ. And they have to take it to their facility ಅಂತಂದ್ರೆ ಚೆನ್ನೈಗೆ ಹೋಗ್ಬೇಕಾಗತ್ತೆ ಅವರು, which is 13 kilometers, 13 hours of travel. Sorry, 13 hours of travel. So they seek the help from us. ನಾವು ಅವನ್ನ ತಗೊಂಡ್ವಿ. So we gave proper care. So the chief wildlife warden of Tamil Nadu was so he was very happy that 2 months ಆದ್ಮೇಲೆ ಬಂದಿದ್ರು ಅವರು. Like tiger is very good now, doing well. So he was speaking about this, the expertise of Mysore Zoo. ಸೊ ಹೆಂಗೆ ನೀವು ಕೇರ್ ತಗೋತೀರಿ, ಲೈಕ್ ದ ವೈಲ್ಡ್ ಅನಿಮಲ್, ಲೈಕ್ ದ ವೈಲ್ಡ್ ಕ್ಯಾಪ್ಚರ್ಡ್ ಟೈಗರ್ ನೀವು ತಗೊಂಬಂದು ಯಾವ ತರ ತಗೊಂಡಿದ್ದೀರಿ. ವಿ ಹ್ಯಾವ್ ದ ರೆಸ್ಕ್ಯೂ ಸೆಂಟರ್ ಇನ್ ಮೈಸೂರು ಝೂ. ಇಟ್ಸ್ ಕಾಲ್ಡ್ ಚಾಮುಂಡೇಶ್ವರಿ ರೆಸ್ಕ್ಯೂ ಸೆಂಟರ್. ಸೊ ದೇ ಆರ್ reciprocated taking the the ideas, like how we capture, keep them, the take crawls, the holding rooms, and the practices, overall practices of rescue center. They are doing it in Coimbatore now. So this one example. Technically, very technically found now. So the OT development. So we have all the facilities like how it is like similar to human. This one, we have most of the facilities, and even we are getting the specialty doctors. Like we try to manage in such a way that ಒಬ್ಬ ಸರ್ಜನ್ ಇರಬೇಕು, ಪೆಥಾಲಜಿಸ್ಟ್ ಇರಬೇಕು, ಒಬ್ಬ ಮೆಡಿಸಿನ್ ಇರಬೇಕು, ಗೈನಕಾಲಜಿಸ್ಟ್ ಇರಬೇಕು ಅಂತ ಹೇಳಿ. So we have this categorization. So yes, and again, and we have the directors now new IFS officers. They give lot of support for the development of entire welfare. So animal welfare ತುಂಬಾ ಇದೆ. ಆಮೇಲೆ recent exchange programs are like we shifted 3 two giraffes from here to Singapore. We are proud to say that giraffes are exotic animals. We bred them successfully in India and we gave 2 of them to Singapore. So this is through sea travel, in a vessel ಕಳಿಸ್ಕೊಟ್ವಿ ನಾವು. And now Mysore Zoo owns the prime species like gorillas. We have 2 gorillas now. So we have 4 orangutans, we have gibbons, we have chimpanzees, as you know. We have white rhinoceros. These are all only in Mysore Zoo. If you take gorillas, if you want to see gorillas in India, it's only in Mysore Zoo. And these are the only 2 gorillas in whole Asia. In all Asia. So I'm very proud to say this. Like we own gorillas in Mysore. So that is very happy moment, ma'am. Yeah, like this we have animal collection plan lagally, welfare steps lagally, and overall we are giving our efforts to improve entirely. And I must be thankful for our supporting forest department and all the IFS officers to contribute generously for the development of entire veterinary wing in Mysore. Yes.
ದಟ್ಸ್ ವಂಡರ್ಫುಲ್. ತುಂಬಾ ಖುಷಿ ಆಗುತ್ತೆ ಮೈಸೂರು ಝೂಲಿ ಇಷ್ಟೊಂದು.
Well, I invite all of them. Please have a look on Mysore Zoo now. Like, please come and experience the. ಇದು ಈಗ ನೀವು ಬಂದ್ರೆ ನಿಮ್ಗೆ ಗೊತ್ತಾಗತ್ತೆ ಲೈಕ್ ವಾಟ್ ಇಸ್ ಝೂ ನಾವು ಹೆಂಗಿತ್ತು ಮುಂದೆ, ಲೈಕ್ ಹೌ ಇಟ್ ಇಸ್ ನಾವ್. ಸೊ you will definitely feel the change. So if you make the visit, you will definitely make the change. Yeah.
Madan,
Madan, it's my dream job to become a wildlife veterinarian. Soon I'll be.
Sure, I'm sure. Please do come. So I like.
on the same note, I was wondering,
Yes,
on the same note,
yes,
I was
sir.
wondering if there are any volunteer opportunities for veterinarians there.
Yeah, sure. Let me know.
So
Like
actually,
externship or
there is
something.
internship program going on, and many US students they come for the externship program. So we have been linked with this Oregon State University. So every year about 5 to 6 students. So So they come all the way from there to Mysore Zoo, and they do their extension program for 3 weeks, 2 weeks. It depends on their individual
Interest.
preferences.
ನೀವು ಡೀಟೇಲ್ಸ್ ನ ವಾಟ್ಸ್ಆಪ್ ಅಲ್ಲಿ ಹಾಕ್ಬಿಡಿ ಮದನ್. I can post it on the group for people who want to, come and do internship Mysore Zooli. And also, is someone is asking how can we donate to the zoo anta? Is there a channel
Definitely,
for
ma'am. So
that?
there is an our website, Mysore Zoo, zoomysore.com. That's all, like, website only. If you go
Oh,
into the website, so even there is a particular app, Mysore Zoo app. Okay, so if you go, you can go and you can select the species which you want. So there will be respective tariffs on it, like you can donate, ma'am, from there. It's
I think
easy.
we
We
can
made it very
adapt
easy.
also, right? Like adoption
Yes,
ಮಾಡ್ಬೋದು
yes, yes.
ಅನ್ಸುತ್ತೆ every day, like
Develop
feeding
ಮಾಡ್ಕೊಂಡು
ಅಂತಾನೆಲ್ಲ.
ಮಾಡ್ಬೋದು. There is
Yeah, yeah.
species wise, duration wise ನಾವು ಪ್ರೈಸ್ ಸ್ಪೆಸಿಫೈ ಮಾಡಿದೀವಿ. ಸೊ ಅದ್ರ ಮೇಲೆ ಅವರು ವಾಟ್ ಎವರ್ ದೇ ವಿಶ್ ದೇ ಕ್ಯಾನ್ ಡೂ ಇಟ್. Yeah. And Mysore Zoo, we don't have any support from government or anything. Like, it's all
yeah,
from the visitors.
private.
Fees.
Fee ಇಂದ ಇದು ಎಲ್ಲ ಝೂ ಹೋಗ್ತಾ ಇರೋದು. Not only Mysore Zoo, there are about 9 zoos in Karnataka. There are small zoos. So Mysore Zoo is taking care of other zoos also. So whatever the income we generate in Mysore Zoo, it is for all other zoos also.
Oh, that's
Yes.
that's fabulous. One last question before we need to wrap this up. Tumba questions ಇದೆ. ತುಂಬಾ ಜನಕ್ಕೆ, this can go on for hours, but unfortunately, we have to wrap up. So one last question. No? Most dog foods advise as to not for human consumption. Why is that? Also, I buy chicken from a local grocery store, cook it in microwave, and feed my pet. Being a vegetarian, this is all I know. So is that okay? They're asking if that's okay.
The labeling is mainly for legal purposes.
Oh,
If
okay.
if you get upset stomach, you get something,
Yeah, then I have to
then
be
they'll be
checked.
liable. That's the only
Yeah,
thing
yeah.
that on there. And microwaving meats, yeah, that's fine. But the thing is, I would rather boil the meat. That way, you get the fat out of it and throw
Oh,
away the water and just use the meat part of it. That way, you're not feeding a lot of fat for your dog. And feeding a lot of fat can, like Dr. Leela said, lead to back attack.
Pancreatitis. Yeah.
okay.
Yeah, and
So
don't change the diet of your pets immediately. Take time. Like you have
Gradual,
to mix and
gradual.
then change it. ಯಾವುದೇ ಒಂದು ಹೊಸ ಫುಡ್ನ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಬೇಡಿ. They don't take it well.
I mean, it depends. Like, if ಹೊಸ food, and then we won't know if they're allergic to it or.
Yeah,
Right.
you never know like what are all the stuff that are in there. Major ಅಷ್ಟೇ ಅಲ್ಲಿ ಲಿಸ್ಟ್ ಮಾಡಿರ್ತಾರೆ. There are a lot of like minor things that we don't even know like what it's in there ಅಂತ.
And also giving the GI tract time to adjust to the new food by gradually switching over by proportion, adding the new and reducing the old one. Yeah.
Yeah.
Thank you. Okay, it's almost time to wrap up. It's almost been 1.5 hours. Eshton questions are there, and Dr. Leela or Dr. Madan or Gangadhar, if you are on social media and on the Global Kannadiga page, please respond to them. Innೊಂದು session ಮಾಡಬೇಕು. This is, we have so many audience, so many people saying it was an amazing program. ಸೊ ಮತ್ತೊಮ್ಮೆ ಗ್ಲೋಬಲ್ ಕನ್ನಡಿಗ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ತುಂಬಾ ಥ್ಯಾಂಕ್ಸ್. ಸಂಡೇ ಮಾರ್ನಿಂಗ್ ಅಂಡ್ ಮದನ್ಗೆ ನೈಟ್ ಪಾಪ ಮಳೆಯಲ್ಲಿ ಮತ್ತು ಯು done so much, and we have people saying thanks to Madan, thanks to everyone, excellent session and very informative, thank you all ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ.
Thank you for this opportunity.
Thank you once again. And next episode of Rooparanga, episode 4, is coming shortly um, in the month of June, May end or June. So please tune into that. And one more Vishya, please like Global Kannadiga page on YouTube. We need subscribers like you to be active, and so that we can go live all the time. Sometimes we have technical issues with YouTube because we don't have enough subscribers. So kandita, please, all my viewers, please go to YouTube channel and like the page. Thanks once again for all of you. It was a wonderful panel, and ತುಂಬಾ informative ಆಗಿತ್ತು on pets and pet care. Thanks once again.
Thank you very
Thank
much.
you so much. ಮತ್ತೆ ನಿನ್ನೆ we had a World Veterinary Day and it was really good that you guys did this. Thank you so much for the
Thank you.
opportunity.
Thank you for the
Thank you.
opportunity.
Thank
Yeah,
you,
thank
Dr.
you.
Madan. Thank you, Gangadhar.
Nice meeting you. Nice meeting Madan
Okay.
and Leela.
Thanks everyone for joining. Yeah,
Thank you. Bye.
thank you.